Information and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, welcome to You and Your Doctor. I am your guest host, Janet Orozco Feller, standing in for Louise Gomez today, and I'm so happy to be here. You and Your Doctor is brought to you by All County Healthcare, a Medicare certified home health agency, and we have the pleasure today of having one of the representatives of All County Healthcare with us. We have Clayton Williams, the Vice President of Business Development. Clayton, welcome to You and Your Doctor.
It's great to be here with you, Janet. Thank you.
I'm so happy to have you.
Thank you.
So it occurs to me that our public may not know exactly what All County Healthcare does. Can you give us a brief description of what you guys do?
Yeah, even though we do sponsor the show,
I know
we
you do
provide
sponsor
for
the
show.
show.
It's not often that
But
we're on the show.
Exactly. So it's not often that we get to talk about exactly what you do.
Yeah, thank you for the question. So we are a full service home care agency.
Okay.
And so that just means we are we're offering skilled nursing services and therapy of physical, speech, and occupational, those disciplines. I'm going to talk to you about respiratory because it's something that Medicare doesn't cover in our service.
Okay.
But we perform whatever the doctor orders, and we are servicing the Medicare population. So anything from wound care, IV antibiotics, medication management, post-surgery care, and then all the disciplines of therapy we provide as well.
Interesting. So you really work hand in hand with the patient's physician on the treatment.
Yeah, we see ourselves as an extension of the doctor's practice. So patients always have the choice to go with whatever nursing agency that they want.
Of course.
But it's like a typical referral when you're checking out of the doctor's office. You're most likely going to go with his lab or his imaging company, his cardiologist who he uses. So we have a relationship with doctors all over the Tri-County area. Mm-hmm. And yeah, we really do see ourselves as an extension of their practice. So we're servicing the doctor's patients, but we also are tied in and delivering value to the families.
Interesting. So let me ask you, how long has All County been around?
All County has been around since the 90s.
Wow.
It's a 30-year-old company.
Nice. So you have roots.
We have roots,
Yeah.
and it's very good to
Amazing.
have that because the reputation is everything.
And you span a few counties.
We service all of Palm Beach and then all the way down south to Miami-Dade.
Interesting.
Yeah.
And so you said that respiratory care is not covered by Medicare.
Yeah, it's something I like to talk about a lot, and the reason is because we feel at All County, we did our research, we invested in things that we had the opportunity to provide to our patients, but it's something that's not necessarily covered by Medicare. So it's us going above and beyond, tackling some of the diagnoses that these patients have, where you could go out and treat the patient, but you really have to ask the agency, what are they actually doing for this particular diagnosis? And so that's where, although like I mentioned, they don't cover respiratory therapy in terms of a billing code, but we do offer that service internally, and we have a respiratory hygiene program is what we call it, and it's managed by our nurses, and we have a on-staff respiratory therapist who acts as a consultant, so he oversees those cases.
Interesting. It seems like that's a big quality of life issue.
It is. We're always graded by how well we're taking care of the patients, and one piece of data that everyone can see, it's reflected on us in the community. Like the doctors see this data, the hospital sees it, and the main thing that they're looking at is the readmission rate. So they want to see the patients that we get and onboard onto our service, how many of those patients are being readmitted back to the hospital while they're under our care. And so, like you mentioned, the huge need for respiratory care, it is the number 2 readmission
Wow.
for patients readmitting back into the hospital. It's the reason for patients are readmitting. So it's
So in addressing it proactively,
is a
you're cutting
huge
down
need
on the
there.
readmissions.
There's a huge need there, exactly.
That
That is the
makes-
goal.
Yeah, that makes a lot of sense. That makes a lot of sense. Is that, I was going to ask you, what sets All County apart from everyone else? It sounds like that's
That's
a
it.
major.
And that's a good question that patients should always be asking. And, I think everyone wants to think about themselves taking care of all patients, but, really specializing in something, like really making an impact in the community, because not everyone can be expert in every single thing.
Of course.
But I think it's incumbent upon the patients to really ask their doctors, like, is this the best agency for what I have going on with me? And we see that all over.
Interesting. So you're in business development. What does that entail?
Yeah, so my role at All County is I do kind of oversee the strategic implementation of new strategies that we're approaching, because healthcare is an ever evolving and changing environment.
Sure.
Things oftentimes are once approved, and then in the future they're not approved, and you have to explain this to the patient. So we have to think about that in a meaningful way when we go out to educate the physicians. Marketing is a tricky word, because we're going out and we're driving business by bringing on new patients. So we do call them marketers, but they're really community liaisons. They're the bridge between the agency, the doctor, and the family. So they're that central contact person. So they do much more than marketing the business. They really hold the hand of the patient through the entire episode of care. But my role at the company is I oversee what those marketers are doing, really try to give them unique things at the agency that they can go sell or provide education back to the community. So we're there as just always learning the needs of the doctors and the patients, and then really trying to follow up and deliver value. So
Yeah, I see your company is very community centered, because I've attended a bunch of events that were sponsored by All County. So you seem to really have a big public outreach arm, and I would imagine that you're very involved in that.
yeah, we live and we die by that reputation, because
Sure.
people want to go to a place that is visible,
Yeah.
reputable, patient testimonies, and then highly referred by their doctor. So that's
So
a
you're
tricky
covering
thing.
all the bases.
It's a tricky thing to make everyone happy at all times, still while providing
Truly.
excellent care and
Truly.
making sure the business is sustainable. But we do that, and we have stayed small over these years, where it's like real boutique, almost family-like environment. And we've, at every inflection point, we've seen what it would take for us to grow. And if there was ever a chance where the quality was going to be diminished in any way, we reinvested back into the people in the business. And we think about these investments in a really meaningful way, because
Sure.
we never want to downgrade the type of quality that we're giving to our physicians and the families.
Sure. Well, it seems like having a home health care agency that's run more family centered, it seems like that would be something that patients and clinicians would want,
Yes.
because this is a very emotional time in the life of a patient when they require home health care. So being able to run it from that perspective, that really would be, to me, something that would set All County apart.
It's a huge selling point for us.
Yeah.
The matriarch of the company is Cynthia Baker. She's like mom to us all, and she started this from
Amazing.
her garage. She's been around. Everyone in the community knows her, but
Culture starts from the top, right? Yeah.
Culture starts from the top, but just to highlight that point that you touched, quite literally, we have family members in the company. So it's almost like when those family members are out in the patient's home, you have an extension of the owners of the company in that patient's home. So
In the home.
all eyes are on us internally, and we almost want to treat every single patient like it's a family member of
Sure.
ours, because
So there's a lot of accountability,
A lot of accountability.
which is great.
And it's a great selling point for us, and our doctors love that. They feel like literally the owner of the business is out in the home seeing their patients.
Amazing. Now, do you specifically have contact with patients at all?
You know, it's interesting. I do a little bit of everything. I started out in the industry doing what our community liaisons do.
Oh,
So
okay.
they were in the trenches every day, doctors' offices, hospitals all day. And I like to keep my skills sharp. So sometimes I get invited to the hospital because I need to come present on all counties' data, just to
Okay.
make the case why we should still be in their network, and
Sure,
they refer
makes
patients
sense.
to us.
Makes sense.
And while I'm there, I mean, if we have a patient that's on service with us and in the hospital, I go and stop by. I get a lot of joy from that because
Yeah, I
they're
would
happy to
imagine.
see you. They're happy to get a visitor.
What's the most inspiring thing that's happened during your career with a patient?
The most inspiring thing that's happened? Wow, Janet, you put me on the spot.
Or the funniest, or give me an experience, a vibe type of experience.
Yeah, I mean, I think I cover every emotion. You know, we get a lot of joy of seeing these patients reach their goals. You know, we have some
must
patients that
feel
are
great, yeah.
chronic, that are perhaps are with us forever.
Right.
And then we have some people that are recovering from a surgery and they're in and out.
So you do both acute and chronic care.
Yeah, and it's that gratification of just seeing no matter what part they are, what stage they're at in their healthcare life cycle of whatever they're dealing with, is just to see it come to fruition and meet their goals and get those good outcomes.
Yeah, yeah. Well, and you know, the home health aide or the nurse or whoever's coming in to see the patient really becomes a part of the family, because it's such an intimate relationship,
It feels that way.
right? Because I mean, you're coming into someone's home and treating them at their worst. They're not feeling the greatest, so it has to be a very close-knit relationship. I would imagine that having that family touch, like you said, really makes a huge difference. It feels less of a corporation, from what you're saying to me, than, you know, just really about the care.
Right. It's not so big that the patients
Yeah.
feel like a medical record number in a spreadsheet.
They're not a number.
Yeah, they're not a number.
They're
And
a person.
to that point, we have a service what most agencies offer, but it's private in-care, like in-home care, and the patients would pay for this. They set a schedule, and we provide them an aide, like you alluded to. But sometimes these aides even live in the home with them.
Oh,
Like
wow.
They
You
elect
even
to
do-
have them
yeah,
24
wow.
hours a day, 7 days a week. So quite literally becoming their family, like an
Oh,
extension
goodness,
of their
yeah.
household.
Wow, that's incredible. And does Medicare cover that?
Medicare does not cover that. So
Okay.
that's something that's usually covered if a patient has a long-term care policy.
Ah, got it. Okay.
And also patients can elect to pay cash. It's very common service. You could just imagine if your mother lived far away from you.
Sure. Yeah, and I wasn't able to be there.
Yeah.
Yeah.
And so
Yeah.
it's the family members either come to take care of mom or dad, or they
Or they have to hire someone
They have an agency come in and do it like
to
us.
come and take care of them. Interesting. So let me ask, in the time that you've been in the industry, how has technology evolved, and how are you using technology to better the care that you provide?
Yeah, it's a great question. Healthcare in general, I think, is very paperwork intensive. And I think it's something that the patients really don't see. A lot
Yeah.
of the magic that happens is behind the scenes. And we were talking before the show, it's like I spend a lot of my time physically chasing around paperwork or making appointments with doctors just to provide them with physical paperwork, which seems crazy in the age of, you know, the internet and
Right.
now AI and
Right.
all these
And you're
things
still
that we
running
have-
around.
we're still running around, and everyone is bound by the fax machine.
Oh boy,
fax. Some of these companies, there's these new technology providers now that are really trying to connect all this data. So hospitals, providers, nursing homes, everyone's got access to the data. And it's actually a very challenging problem to solve. You would think it'd be like something as simple as encrypted email, and people have tried that, but it creates all these silos. So I'm looking forward to the day where all those pieces are there on the technology side of things for us in terms of the data and moving patient information and even giving patients access to that information. So I'm hopeful that that future will change, because it sounds kind of archaic that we're still on the fax machine. But
It does. It really does.
but two pieces of technology that's in our industry that's right now, it's really interesting. All County has IPV therapy.
Okay.
So it's a machine that we bring out to the patient's home. So if we always tell the doctors, like, if you have an agency that provides this for your COPD patients and you love that agency, send them to that agency. With our research, we've gone through the manufacture of these machines, and these machines are only offered in like intense care units, like in hospitals, burn units, that sort of thing. We provide this machine in the home, and it is a sure shot way to break up an obstruction. So if someone has COPD, we know that they're chronically obstructed, so they can't get a nice, good deep breath or take a deep cough. So this is like what we call it is a respiratory therapist in a machine, someone that would be doing CPT treatments. This is a high pulse, high frequency ventilation, and it's sending boluses of air. It breaks up all those obstructions. The patients can get the mucus up, and they get to take a wonderful breath and get to have a nice cough.
And that can be done in the home?
That can be done in the home.
You're one of the...
I think I do say, and someone can fact check me on this and they can call on the show, but I do believe that we're the only people that offer that in the state of Florida.
Wow.
And that was from the investment.
Wow.
Something else I wanted to mention to you.
Hang on one second,
Yeah.
because we're going to have to take a brief pause for commercials,
Brief
but
break.
hold that thought, because I want to know the something else. Don't miss it.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we are back at You and Your Doctor. By the way, You and Your Doctor is brought to you by All County Healthcare, the Medicare certified home health agency. To contact them, please call 954-717-7027, or you can email them at info@allcountyhealthcare.com. And we are joined today by Clayton Williams, VP of Business Development. And Clayton was just telling us about how technology has impacted the industry. And you had mentioned to me earlier that there was some technology with wound care that has evolved and has really been a game changer. And I'd like you to tell me a little bit about that.
Yeah, I was all fired up about the technology.
Yeah.
It's a good question, and if anyone's in our space and our part of the healthcare industry, they've seen this, and it is probably the newest thing. Going back to your question, like the newest evolving technologies in the business, and it's these skin substitutes, is what they're called.
Is that like regeneration?
Sort of. It's
Okay.
because they are made with amniotic fluid from the placenta. So
Oh, wow.
this was something that was outlawed years ago, but it's a new technology. It's been evolving. It's been probably on the market about 6 years or so.
Incredible.
But yeah, this technology heals these wounds fast. And I would tell you, just to contrast a little bit, at the beginning of my career, I managed a nursing home from the marketing perspective, and we would have these patients, and they would have these serious wounds, Normally, infection, the wounds would cause them to bounce back and forth to the hospital. A lot of them are bed sores, so that's where they're located on the body. And you have these people that are maybe not ambulating, they're not moving around the facility, so they're in the bed all day. And it was a monster to treat these things. And you just think about the cost of the healthcare system. Someone's living in a nursing home, bouncing back and forth to the hospital, dealing with something that you really couldn't solve for. Like, you just almost had to treat the wound and like live with it. It's like something that the patient's gonna live with. These skin substitutes, these amniotic grafts are healing these wounds.
That's incredible. Even bed sores that they're laying on?
Yeah, I mean, every wound's a little bit different. The bed sores are not the most common wounds, but they can be deadly. And yeah, I mean, it's amazing to see what these grafts are doing.
And you guys are doing this inside the home? They don't have to.
So we're not doing it inside the home. What we do is we supplement any physician who would be ordering these grafts. But like the typical referral process for All County, we're in the home as the dedicated agency. So our nurse is piggybacking off of the wound care that's being provided by the wound care team. And we're managing the wound during the week.
So you're managing
dressing
at home.
Changes.
Right, you're managing it at home once they're released.
Providing back information to the doctor. Yeah, we see them at all stages.
And probably also recommending that they go in for it.
Recommending if the wound happens, if it evolves under our care, we try to get way ahead of it before it gets worse.
Sure. Wow, that's incredible. I didn't know that.
It's new, and it's
that could
all over.
be done.
Yeah, I mean, it's ever evolving, and it's like anything else. I think there's a lot of investment going into this space. So who knows what the wound grafts will be like in 5 years? But again, we like to see the outcomes with the patients.
Of course,
we have an incentive to do so. So we get the patients on service, and our goal is to give them a great outcome. We want them to get better.
Yeah. So what do you see is the future of home health?
You know, it's a really good question. So we all know that when we turn 65, you can elect to get your Medicare benefits. And this is not insurance advice. I just say it as someone who lives in the trenches of the industry. Is like, there are a lot of things that straight traditional Medicare cover that you don't get the luxury of having the same liberal benefit as you were entitled to when you turn 65, if you elect to go in like a commercial plan that's managed by the large insurance companies. So like your Humanas, Aetnas, that sort of thing. I would say, I guess, to anyone listening, you consult with your family, your broker, you do an equation of the medications that you're on monthly. And I think the thing to really think about in a meaningful way is like, what happens under this insurance plan if mom or dad goes to the hospital, if mom or dad needs to go to a rehab or nursing facility, and how much care are they getting in the home? We know that every patient's different, but some families really do need that extra assistance that's provided from traditional Medicare that gives that nurse, if the doctor orders it, that nurse can go once a week. And it's an extra set of eyes on mom and the dad. And sometimes that's that extra set of eyes that could be life or death, you know, that nurse that comes and shows up.
That's solid advice to really review your policies and your needs and your medical history, or the patient's medical history.
Yeah, and all patients can know that if you're in any kind of Medicare product, it is your right that you can leave that commercial product if it's not the thing that's serving you the best way at the right time. So
that makes a lot of sense.
Back of your Medicare card, you flip it over, 1-800-Medicare, and you can call and you disenroll, and you get right out of that plan on the first of the next month. Again, this is not insurance advice, but it's something that if you're not well versed and if you don't study these things, patients have no idea. They assume that their Humana plan covers the exact same thing, their traditional Medicare A and B, and that's not always the case.
So the advice being, consult your professional and really go through the policy and make sure that it's meeting your needs as they are.
And tease out some, what would this insurance be like if X,
If,
Y,
right,
and Z were
right.
to happen. So I think it's a very healthy practice to do.
That makes a lot of sense. Incidentally, did the government shutdown affect you guys at all?
It's a good question. Short answer is no, not really.
Okay.
We, no matter what, we were going to still, because there was always little bits of uncertainty. It's one of the things the government likes to do. It's like say, we don't know, but ultimately Medicare claims got paid. I think just in terms of the revenue cycle, it's probably, they just paid a little bit slower, but claims were getting paid during the shutdown.
Excellent. Excellent. Well, it looks like we are out of time. Clayton, it has been such a pleasure having you with us today. Once again, this show is brought to you by All County Healthcare, the Medicare Certified Home Health Agency. Call them at 954-717-7027 and reach out to them at info@allcountyhealthcare.com. Thanks so much for joining us. Have a wonderful evening. And thank you, Clayton.
Thank you.
It
You're
was
wonderful.